Hello Andrew, my name is Sharon. We're going to be doing the allergy testing on you. Today I'm going to give you some paperwork to fill out, okay? I have a couple of questionnaires for you to fill out for Dr. Doucet and also what we have to offer by this sublingual therapy, okay? I'm going to give you that. And while you're filling that out, okay, I'm going to clean your arms with some alcohol. And I'm going to write on you. And then we're going to do our controls on you, which is histamine, glycerin, and saline, okay? Just do the real one. So the next part of when I'm going to put the histamine controls on you, this is what I'm going to do to you. There's the opening of the needle. That's all I'm putting under your skin is just that. I'm not putting the whole needle, just that little opening. And we need to make a whelp, which is called a wheal. And over time we watch that to see if it grows or if it stays the same size or shrinks. Okay? Okay, so here we go. You feel okay?
Yes, ma'am.
Great, great. Just a little sting, that's all there is to it. Okay, so let's go ahead and time that. What I have is a prick test, okay? This is some sharp plastic that we're going to put on your forearms. I'm going to rock it on your arm. When I take the plastic off of you, I'm leaving some oil there. And over time, I'm looking to see if any whelps appear. Or if there's no whelps at all, then that item you're going to be negative to. But over 20 minutes, you're just going to have to stay sitting like this for 20 minutes, okay? All right, so palms up, okay? And I'm just going to rock it, okay? It's going to pick a little bit. You feel okay?
Yes, ma'am.
Okay. Okay. All right. Okay, it might start to itch and tingle a little bit, and also there might be some redness that appears, okay? So just relax, and I'm going to be right here with you. I'm going to do now, since the timer went off, I'm going to go ahead and wipe all this oil off of you, and then we're going to measure to see if there's any whelps that are there, okay? Wipe that off, the little marks off of you. And the next part of the test is the individual needle sticks, exactly like I did the first three, okay? Okay. Now these might start to itch and everything, but don't scratch, okay? After I finish the whole test, I'm going to go ahead and spray some Benadryl on you.
Okay.
What I'm doing, I'm just writing some numbers on you, and then that correlates with the panel on the paper and on the tray. Okay, all right, you can move your arms if you want while I get all this ready. Okay, with this part, it's going to be like the first three that I put on. I'm barely putting the tip of the needle under the skin, okay? But with this, I have to make a certain size also.
Yes, ma'am.
All right, great. Now, after I put all this on, we're going to go over a few things that you could be doing at home to help control your allergies, which is a little bit of environmental control. This arm. Now I'm going to turn you around and I'm going to do the opposite arm, okay?
Okay.
Okay. All right. This is going to stay on you for 10 minutes, okay? Okay, as far as environmental control at home, there's some things you could do. Getting an air purifier for your bedroom, okay? That goes according to the room size. You can pick that up anywhere. Bed Bath & Beyond, Walmart, Lowe's, Home Depot. You can even go online on National Allergy website and order the air purifiers. You have to measure your bedroom first. It goes according to the room size. And there's all kinds of prices from cheap to expensive. So just find something that can fit in your budget. There's also some that have filters and some that have no filters. Next thing is dust mite covers for the mattress, box spring, and pillows. Try to vacuum your room often, okay? Dust mites live in anything that's fabric, okay? There's also some saline you can purchase, which is just Pret spray, has a moisturizer in it. Especially on high pollen days, you can rinse your nose with some saline, and that's going to rinse the pollen and the dust out of your nose. Then whatever medicine Dr. Doucet puts you on, whether it's by mouth, okay, or a nose spray, and then doing some type of immunotherapy. It all works together, whether you do the allergy shots or the allergy drops. If you decide to do the allergy shots, you have to come to the office to get your shots. For the first 2 weeks, it's twice a week, then after that, it's weekly. Your other option is an allergy drop that you can put under your tongue, okay? But the allergy drops you put under your tongue, you purchase them first, we mix them, and then we'll call you when they're ready. That's a whole bunch of information for you to go home and think about. But with the medicine by mouth that Dr. Doucet would prescribe, it's an antihistamine sometimes. And what happens is when you have allergy reactions where, that's not what I wanted to say.
Just keep going.
When your allergies are flaring up, sometimes the medicine by mouth doesn't help you to where your body is overproducing the molecules in like Zyrtec or Claritin. Doesn't have enough antihistamines in it to stop the allergies, okay? That's why you need all the rest of the help from the allergy shots. All right, so now that the test is finished with, I'm going to go ahead and measure these whelps that are on you that I personally put on you, okay? And what I'm looking to see is how big they are, okay? And I'm going to wipe all of this off of you, all right? After I'm done. feel okay?
Yes, ma'am.
Okay, I'm going to turn you. Okay, I'm going to do the opposite arm. Go ahead and clean you with some rubbing alcohol. I'm going to turn you back around, okay? All right, okay. So the test is complete, okay? And what I'm going to do, I'm going to go ahead and give you your results, okay? And give you all of the options that you can do for your allergies. Okay. When we're doing the allergy test, okay, we have vials 1 through 6. 1 is strongest on the tray. Each one is diluted 1 time weaker and weaker, okay? If you react to anything on vial 6, which is very sensitive, and that's the ones that we have the whelps, okay, you consider it off the chart, okay, which was cat hair, and I have 2 of the moles, which was Helminthosporium and Cladosporium, cockroach dust, and the 2 dust mites. You're off the chart completely with that. So then the next step of the test is to take the items and put them under your skin at a different dilution to see how you react to something under your skin. You reacted at a dilution 3. Bermuda grass, sweet gum tree, hackberry tree, Johnson grass, live oak tree, pecan tree, English plantain, which is a weed, river birch, that's a tree, dog, and I have 2 more moles, which is aspergillus, gillus, and penicillium, okay? So there's some options that you can do, like as we said earlier. Environmental control at home, whatever medicine Dr. Doucet puts you on, and then doing allergy shots, okay? So everything works together. We're going to set you up an appointment to come back to visit with Dr. Doucet. She's going to give you her recommendations, and then we're going to go from there, okay?